What do the voters need from you they're not getting from somebody else?
Well, I think what they get from me is someone who has a real vision for the future and has a way of making it all happen. I think voters should ask every presidential candidate, what's your plan to build a better future? How are you going to pay for it if it involves investing in programs? And how are you going to get it done? And I don't think any candidate can answer those questions better than I can. For all the issues that are affecting the American people, particularly American families, at their homes and the issues they talk about at their kitchen table, I have the best vision for that future. And I have a pathway to find the kind of common ground that we need to get it done. So many of the candidates are running on these impossible promises or fairy tale economics, where I actually have real solutions that we can build a better future around.
So let's talk about some of the specifics,
sure,
particularly when it comes to economics and the economic future here. We have some of the things that you've laid out, like a $15 minimum wage, and also expanded health care, but not Medicare for all.
Yeah.
Is that a defensible position with respect to the Democratic base?
Yes, it is, because I'm for universal health care. I think every American should have health care as a right. The problem is I believe single payer is a really bad way to go about it, because that will result in a health care system that is underfunded and has more limited access. If the government is the only payer in health care, because the government doesn't pay the full cost of health care, you by definition will get a system that's underfunded. So what I'm for is a universal system where everyone gets a backbone basic government plan, but then people have options. They can opt out, they can buy private insurance, they can buy supplementals, they can keep their health care from their employer. It's called a mixed model. It's like what Germany has. So that, I think, is a much better way forward.
So how are you going to pay for it? To borrow your question.
Sure, it's fully paid for.
But right now we have 18% of the GDP going for medical health care, right? We can't keep going this direction.
No.
At some point, you've got to bring the costs down, not just put more government dollars in.
And I think a universal system will ultimately bring the cost down, because right now we actually have universal health care. David, it's called the emergency room, and it's the most expensive form. So my system is fully paid for by eliminating the corporate deductibility of health care, which is the largest loophole in many ways we have in our tax code. And then I take those dollars and I use it to provide universal expansion. But then what people who work for companies can do is they can opt out of their basic government plan, get a voucher because they're not using the government plan, and give it to their employer to help pay for the health care.
But if my company doesn't get a deduction anymore for my health care, won't they opt me out?
No, what I think they'll do, for example, what I think Bloomberg would do is you'd show up with your basic government plan. They would say, we want our employers to have more options. We've negotiated a group supplemental plan that adds on to your government plan that gives you the same benefits you have now. But that costs much less because your major medical, if you will, is provided by the government plan. So you'd end up in the same way, and but that's how it would all work.